microphone today because I'm also involved in the British Medical Association, and I've been allowed to speak on behalf of the London Regional Council of the BMA to welcome you marchers on behalf of London doctors. And our London doctors have been fantastic. We've got a lot of doctors who have supported all our campaigns, and especially the Save Lewisham Hospital Campaign, where we had GPs and hospital doctors all across. We would not have been successful if they hadn't been supporting us. We need all health workers, all NHS workers, all the people, all the patients, the pensioners, people up and down the country in all walks of life to build the kind of movement that we are going to need to defeat the threats to the NHS, the threats of privatisation and cuts. And you, the Jarrow March, the Jarrow NHS marchers, have been a fantastic inspiration, and you have brought together, you've woven together the whole country. You've shown that London is no different from the rest of the country. We're all facing the same cuts and closures and threats to our hospitals and our GP practices, the threat of privatisation. So we must all carry on working together. And the Jarrow NHS marchers are giving notice to our politicians. They're giving notice and they're saying you must pledge to support the following demands which they're making, which is repeal the Health and Social Care Act, halt and roll back the privatisation of the NHS. We've got to deal with the issue of private finance initiative and free hospitals from the destabilising burden of those PFI debts. We've got to end the cuts and closures of our hospitals, which are all cash driven. They're not driven for quality reasons, they're driven by the desire to save money. So stop the hospital and GP practice closures. We've got to have a fair deal and fair pay for NHS staff. And the NHS needs to be properly funded. It's being starved of funds no matter what the government says, and we need to increase funding for the NHS to meet the absolutely just and necessary demands and needs of our people for a decent health service. So I think we've got a really good set of demands that can unify our movement and bring together health workers and the public and patients and people across the country. And I'll say to you that we need more and more doctors to get involved. We've already got many, but we need to build that support amongst medics, amongst nurses and amongst all healthcare staff. Thank you very much.